We'll begin with the slides that we didn't show at the end of our respiratory lecture last time. All right? Could we have the first slides, please? Pretty hard to see it. We need to dim lights, please. All right. Now, can anybody tell me what kind of lymphatic tissue this is? Because it has stratified squamous epithelium, very light up here. Tonsils. Good for you. The tonsils are the only ones that you'll see that will have stratified squamous epithelium because that's what lines the oral cavity. And these are just beneath the surface in the posterior oral cavity. And they only produce cells. They do not filter lymph. There's no way lymph can get through the stratified squamous epithelium. Next one. And here's our lymphatic system. We talked about the cisterna chyli. Sometimes it's spelt with a Y, sometimes with an I. And that's a reservoir of lymph that's been collected coming up and from the digestive system as well, and comes up the thoracic duct all the way up to the junction of the internal jugular vein and the subclavian vein coming in here. These are all lymphatics, but the veins are here where these will empty into. The right arm and the right side of the face will go into the right lymphatic duct, into the right internal jugular and the right subclavian. In the next one. Now, what kind of epithelium do we have here? It's pseudostratified, columnar. What are these? Cilia, ciliated with goblet cells. Goblet cells are filled with mucus, so the nucleus is pushed way to the bottom. So as this is the most complex epithelium, and we see it. Whoops, am I still on? I thought I lost it. All right. Our respiratory epithelium that we find in the nasal cavity and in the larynx and so forth. In the next one. And this is the venous plexus. We said it was essential to warm air. So here's our epithelium out here. But it will be warmed by passing by this warm venous plexus beneath the respiratory epithelium. In the next one. And then we have our tonsils. We'd have our lingual tonsil on the base of the tongue. We'd have the pharyngeal tonsil. No, is it pharyngeal here? No, it's palatine. Palatine tonsil back here. And the pharyngeal tonsil will be up in the nasopharynx, up in here. And these show the turbinate bones, or the conch. You see both terms. They increase the surface area by being curled. This is inside the lateral wall of the nasal cavity. Here are the external nares out here. Internal nares will be in here, getting back into the nasopharynx here. With the palate here, maxillary bone here, palatine bone here, uvula going down here. Next one. All right, and this shows looking inside the nasal cavity. Here's the septum, made up of the perpendicular plate of the ethmoid, of the vomer, and of cartilage. And here's the inferior conch. You can see how curled it is. So we look at it longitudinally, it looks just like a straight piece of bone, but it's actually curled to increase the surface area. Otherwise, the lateral surface would be that much. Here we have all of this exposure to our epithelium. Next one. And this shows the palate, maxillary, palatine bone. Next one. And this shows, again, the two ways in which you can see the conch. Did you ever know you look that way inside your nose? It's rather impressive, isn't it? This is the vestibule. It has hairs here. Don't clip those hairs. They're to keep bugs out. So, all right, next one. Oh, this just shows the position. This is a little artistic. I don't think that our nasal olfactory epithelium is quite as robust as this, but it is in the superior aspect of your nasal cavity. In the next one. All right. Now we're going to begin our review. And I do this, and I know some people say that it's foolish, but it's another way of teaching. And I consider if you learn nothing else in this class, you'll learn the answers to 50 questions about anatomy. Right? No, I'm serious. I really want you to learn this. And this way you'll say, gosh, I did learn a lot. But no, I didn't. Now I'm going to get busy and study for the rest of the semester. So I'm doing my best to teach you anatomy. All right? So first slide. Good. After a fracture, which of the following is not part of the healing process? A blood clot forms between the two sides of the fracture. Here we have our fracture. Are we going to form a blood clot there? Come on, you've got to talk to me or I'm not going to move. We'll be on only one question. Do you? Well, of course you do. Do we form a bony collar between the two ends? Yes. I can see it's only a few of you studied. Another way I learn. You wait for a review. Sometimes I don't give a review. We may not give one for the second exam if I don't get a good response, okay? And we won't finish this one if you don't respond, all right? So speak up. You're here to learn at this great university. So yes, we have a bony collar. Is there a callus formed with bony particles between the two ends? Yes. Do we have periosteal fibroblasts that form osteoclasts? Good. No, there are no osteoclasts at this stage. New slide. What muscle is this? Come on, the whole class. You're on the frontal bone. Thank you. But I do want you to learn to speak. The students thank me later for the only class they have to speak in. Learn to speak, so I don't have to keep preaching. Right? All right, so you know it's the frontalis muscle. Does it connect to the galea aponeurotica? Yes. Does it raise the eyebrows? Good gosh, you'd sure flunk. What does it do? Raise the eyebrows or not? Yes. Does it have bony attachments? No, because it's coming into the eye muscle here, and it's coming into the galea aponeurotica up here. So, can it raise the eyelids? No. What raises the eyelids? The levator palpebrae. Good for you. Speak up. All right. We're going to keep the same one. Which muscle closes the eye? Does the orbicularis oris? Does the orbicularis oculi? Yes. 18, let's see. The orbicularis oris inserts on the squamous portion of the temporal bone? No. On the contralateral side of the cheek? Cheek? No. Gracious. On the contralateral side of the mouth? Yes. Finally, one of you know it. All right, now we've got to go back to this one. Next slide. What two muscles close the jaw? What muscle is here? What's it called? Temporalis, sure. And what's the other muscle? Masseter. Is it here? No, it's not on the mandible down there. Is it here? Yes. All right, so you have a temporalis and you have a masseter. And the masseter is going to come down and insert where? If nothing else, what bone is this? Mandible. Ramus and angle. Somebody has studied. Thank you. Let's go on to new slide. What muscle is this? Trapezius. At least some of you know that. Does it insert here? Yes. Does it originate here? Yes. Does it insert over here? No. So let's see, same as 19. Here we have a muscle coming up here. What muscle is this? Latissimus dorsi, right. And it inserts where? The what? The intertubercular groove of the humerus. So it does not function to medial rotate the humerus, does it? Sure. Does it adduct the arm? Sure. Just look where it's coming. If it's going to contract, what's it going to do? What do we call the process of bringing the arm down close to the body? Adduction, right? Does it draw the shoulder down and back? Sure. Okay. Does it raise the arm? No. Good. At least you're thinking there. All right, next slide. All right, what muscle's beneath here? Pectoralis major. Did you all say it? Did you all know that's the pectoralis major? I didn't see you say it. Did you say it? You did? I didn't see you. You're too busy with your computer. You've got to learn to do both these days, right? If you could speak on the phone and drive a car 80 miles an hour, you can certainly do your computer and announce something here, right? Get duplicity in your brain. Here we go. So we know this is the pectoralis major. Does it originate on the clavicle? Yes. Does it originate here? What is here? Good for you. Does it originate on here? Yes. What's under there? Costal cartilages. Good. Does it originate over here? No. Okay. New slide. What muscle will this be coming down here? Triceps. Good for you. Does it insert on the radial tuberosity? Yes, it inserts on the olecranon process. The radial tuberosity is way down here. So, new slide. What is all of this? Say it. What's this white tissue here? You didn't say it. What is it? Did you say it now? I can't see your mouth. Aponeuroses. Okay, thank you. Now the question is, which is not correct about the rectus abdominis? Is this the rectus abdominis beneath here? Yes, it's straight and it's in the abdomen. Can't you see yours? Picture where it's originating, where it's inserting. Did you try that in the shower this morning? No, you didn't take a shower this morning. No hope. All right, here we go. Which is not correct about the rectus abdominis? Does it originate on the pubic bone and the symphysis? Yes. Does it flex the vertebral column? Yes. Is it surrounded by 3 layers of aponeuroses, both superior and inferior to the umbilicus? Do you have 3 layers up here? No, you have the one coming from the external oblique and the one coming from the internal oblique, but the transversus is posterior. When you get down here, you have the superior oblique, the inferior oblique, and the transversus all coming in front to give extra support. We made a big point of that when you watch these big pregnant women with twins, right? So, same as this one. Now, the aponeuroses of the external oblique is not involved with the following. Is the external oblique involved with this structure here? What do you mean, no? What is the structure down here? The inguinal ligament. What's it made of? The aponeuroses of the external oblique. It folds over, will form the inguinal canal, and it forms the inguinal ligament. So is the inguinal ligament attached anywhere to the ilium? What part of the ilium is the inguinal ligament attached to? Gracious. Yeah. Boy, we've got one A+ student right here in the row. She really is studying. Did any of the rest of you know that your inguinal ligament goes from your anterior iliac spine to your pubic tubercle? Good, thank you. All right. Where is the mediastinum? Is it in the pelvic cavity? In the abdominal cavity? No. Where is the mediastinum? Thoracic cavity. I ran into a medical student the other day. He said the most beautiful lecture in medical school was on the mediastinum. And I taught you that, and you don't even know. Gracious, and you want to go to medical school? No. I saw that answer. All right, but this is not trivial material. It's basic. And that student said the best lecture he had in medical school was on the mediastinum. And here you are thinking it's in the abdominal cavity? All right, now, what is found here? Linea alba. What does linea alba mean? White lines. So if you're going to do surgery, do you want to cut down the linea alba? Yes. Why? There are no blood vessels. And why do the women all want to have their C-sections now down in this direction instead of, as we used to do it right here? Purely cosmetic. They don't want the scar to show up here when they wear their bikini bathing suits. They get the slice down here. But boy, would you do that? If you knew your anatomy, you'd stay in the midline. All right, so that's your linea alba. Same slide. Which is not a function of the external oblique. Does it aid in breathing? Yes. Does it aid in defecating? Sure, unless you have diarrhea. Right? Okay, but think about your body. Get to know it. It's going to be with you for your 100 years. Does these external oblique support the floor of the pelvic cavity? No. Good for you. Does it aid in childbirth? You bet it does, and you're really happy that you have it. Have you ever watched childbirth? How many have watched childbirth? Just a few. Don't you think you need good, strong external obliques to help? After you've watched, you need every bit of help you can get. All right, new slide. Here we are. We're down in the perineum. And which is not correct in the pelvic floor? Is the anus between the coccyx and the median raphe? Here's the anus here. Coccyx will be here. Where's the median raphe? So is the anus between the coccyx and the median raphe? No, it's superior here. Is the vagina posterior to the urethra? Here's the urethra, here's the vagina. No, it's anterior to the urethra. Remember, we labeled all of these for you? Part of the body. New slide. Well, here we are. Now, what do we call this area? You mean after all that and you still don't know? Mediastinum. Right. Do you have silencers on your voices? I don't hear you. But what we want here is which of the following is incorrect? Is the apex in the fifth intercostal space? Yes. Is the heart the size of a spleen? Yes, you know that. Is the heart 2/3 to the right of the midline? No. All you have to do is look at the midline here, and you've got it way over here on the left side. New slide. Now, the parietal layer of pericardium is adherent to the visceral layer? No. Why isn't it? If it were, what would you obliterate? Pardon? I don't hear. I'll stand here. We just waste minutes. I mean, you've got it right here. The visceral has to be here. The parietal has to be here. What's in between? Pericardial cavity. Don't you know that? Have you not studied anything? My gosh. Maybe I should quit now and let you go home and study. Well, then I want you to answer. Otherwise, I'm going to quit. Because I do. I mean, I'm not here for fun. I'm here. It is fun for me, but not for you, it sounds like. Okay. Now, what's this heavy fibrous layer way out here? What's it made of? If you're going to make a heavy fibrous layer, what are you going to make of? What are the tools? Collagenous fibers, right? Collagenous fibers. You should know the tools that you're working with in the body. You're Cal students. I can't believe this. I've taught all over the world, and I've had much more response than this. Let's go. I've bawled you out enough. Let's spend our time doing this. Okay. Is the parietal layer adherent to this tough outer layer? Yes, you can see it. All right. New slide. What is this lined with? What is this lined with? I'll wait. No, there are no pectinate muscles there. Pectinate muscles are out here. What's the lining inside the heart? What kind of cells are you going to have lining? Epithelial cells, but what do we call them in the heart? Endocardium. Good for you. Somebody knows it. Endocardium. So is the endocardium continuous with these blood vessels that are coming in? Sure. We call them endothelial cells, right? They're the same kind of cell, simple squamous cells, but they're endothelial cells coming in with the blood vessels, but the whole heart is lined with endocardium. Now, is the pacemaker here? Is the pacemaker up here? Yes, sure it is. What do we call this? Pardon? What do we call the area where the pacemaker is? The right atrium. Good. Now, during diastole, are these valves open? During diastole, first you, sure they are, they have to be, right? Because what's diastole mean? Filling, right? This is a learning session too, so I hope you're learning. If you haven't learned it before, I hope you're learning it now. This is fundamental. Nothing. You've got what kind of valves? 1, 2, 3. What are they called? Tricuspid. Say it. What do they call these? Chordae tendineae. What do they call the muscles that chordae tendineae attach to? Papillary muscles. It's beautiful. It's all there. All you have to do is learn it. So that's that one. Then we go to also 31. Let's try a new slide. Okay, what vessel is this? No. What is it? Pulmonary trunk, right. Now, which combination of words are true? The auricle and the atrium are the same structure. True or false? False. The foramen ovale was formerly the fossa ovale. True or false? False, sure. The pectinate muscles are the same as the trabeculae carni. False. The pulmonary trunk and the pulmonary arteries both carry venous blood. True, sure. You know that one. Good. All right. Which vessel carries oxygenated blood? The pulmonary artery? The pulmonary veins, right. New slide. This is a slide with Purkinje fibers. What do Purkinje fibers do for you in your heart as you're sitting there trying to answer these questions about it? It's a conduction mechanism, isn't it? Does it line the tricuspid valve? No, we certainly don't want it there, right? What does the vagus nerve provide to the heart? Autonomic control, but autonomic control has two divisions. What two divisions do we have in the autonomic nervous system? Sympathetic, parasympathetic. Now we're talking. And what is the vagus nerve? Sympathetic or parasympathetic? Parasympathetic. So what does it do? It slows the heart, right. New slide. What kind of an artery is this? Pardon? Elastic artery. Right. You don't see the muscle, you don't see anything but little wavy lines which are elastic fibers. So when it expands after the heartbeat, these can contract and help propel the blood. So which is not an elastic artery? Is the brachiocephalic an elastic artery? Yes. Is the subclavian an elastic artery? Yes. Is the common carotid an elastic artery? Sure. How about the brachial? No. At least you know where it is. Now, next slide. All right, what artery would this be coming off of the ascending aorta? It's a coronary artery. So, which is correct here? Atherosclerosis begins in the tunica media. No. In coronary arteries cause 1/3 of the deaths in America. Yes. Think about it. That's really high. Does atherosclerosis never occurs at bifurcations of arteries? True or false? False. Atherosclerosis cannot be reduced in coronary arteries with the procedure called angioplasty. False. Sure, that's still used. We don't know when the lasers will take over completely. Next slide. All right, we want an endarterectomy is a procedure scraping off plaques from the tunica adventitia of the, which artery is this? Pardon? Common carotid. So, does endarterectomy scrape off plaques from the, where to get it from? The tunica adventitia. No. Will it scrape off the tunica intima? Sure. All right. Now, we follow the common carotid up, and at what level does it divide into the external and internal carotid? Somebody asks you, where's the division between the internal and external carotid as it comes off of the common? What would you say? And be exactly correct. At where of the larynx? What part of the larynx? The superior boundary of the larynx. So you can find it right away. All right. So now, which is not correct? The internal carotid artery terminates in the middle cerebral. Does the internal carotid terminate in the middle cerebral? I hear one lonely little voice. Now I hear lots of wrong voices. It's a main one that I gave you. I said the internal carotid, which is coming to the brain, if I make my hand be a middle cerebral, it supplies the whole lateral aspect of your cerebral hemispheres. That's middle cerebral. I said, if you remember nothing else, you'll get that on the floor by the resident the minute you get a case that deals with the brain. What supplies the lateral aspect? And I want my students to say middle cerebral. Okay? Now, I could use this because middle cerebral should be coming off here, supplying all of this. Does anybody remember where I said Broca's area was? First place, do you remember what Broca's area was? It's language, motor speech. I could give you lots more, which were different kinds of speech. I gave you motor. For me to be talking to you now, my Broca area is firing, and I want yours to fire too, so I can hear you, right? Now, if the middle cerebral is supplying all of this, what was supplying the outer rim here? The anterior cerebral. Boy, that's a voice that I like to hear way back. The anterior cerebral. So the question is, does the anterior cerebral supply Broca's area, or does the middle cerebral? The middle, sure. All right, now, what do we call this big, whoops, this big vessel coming down here? Pardon? But what specifically? Abdominal aorta, right? And you're going to have that in 131 today because we have the cardiovascular surgeon today. And he'll show you how he can replace arteries. All right, so this is your abdominal aorta. And so we have paired branches coming off. We have these paired branches coming out here. What are the long ones? They've got a long way to go. Gonadal, because in the male that testicular artery has to come clear down to the testis. In the female it only goes down to the pelvic cavity. But we've got another pair up here. Where are they going? Renal. So the question is, the renal and gonadal arteries come off the abdominal aorta between the superior mesenteric and esophageal. No. The superior mesenteric and the inferior mesenteric. Yes, good for you. Same as 42. All right, let's follow the external iliac. The external iliac, here we had the abdominal aorta coming down, goes into the common iliacs, and the common iliacs split into the internal iliacs to the pelvic viscera, and the external iliac becomes the femoral. At what level does the external iliac become the femoral artery? The inguinal ligament. You've got it coming right across here. Very clear to see. And we had, in what triangle was the femoral artery? Okay. Good. New slide. Where are we? Skull. Good. Well, I just want to be sure. I mean, only 2 of you answered. The rest of you aren't smiling. Are you running scared? I can feel it. I feel those who know and those who don't know. I have that extrasensory perception. All right, we're inside the skull. What do we call this? At least those of you in the lab should know that. You see it. What's it called? What's it look like? Does it look like a sickle? Falx cerebri, right? Comes down between the 2 hemispheres. So the question was, venous blood from the brain runs in blank to reach the internal jugular veins. Does it run in veins? Does it run in capillaries? Does it run in dural venous sinuses? Yes. So you've got your dural venous sinuses here. Dural venous sinuses. Don't you wish you'd been studying? You could have been learning all this. You have to wait and get it this way. Fascinating what you look like inside your skull. So these are dural sinuses. This is dura mater. The specific one is the falx cerebri. We gave it all in class. Now, who can tell me what we call this sinus, which is running down here in a straight line? The straight sinus. So what's the sinus that's superior up here? Superior longitudinal sinus. So what does a straight sinus connect with the superior longitudinal sinus? The inferior longitudinal sinus. Good. New slide. New slide, please. Now, where are we here? What's our triangle here? Femoral triangle. What's this vein coming up here? Pardon? Ooh, we're superficial. We're not deep. What's the big superficial? Pardon? Saphenous vein, right? Your big saphenous vein coming up the medial aspect of your leg, coming into your femoral artery, femoral vein way up here. Now, phlebitis is a condition concerned with A, plaques in arteries, false. Inflammation of venous valves, false. Inflammation of the tunica intima in veins and with blood clotting, and it's very painful. Yes. Phlebitis, you definitely. Does anybody have a relative who's had phlebitis? Nobody? My, yes, 2 of us. All right, so we know it's in the vein, and it's in the deep femoral vein, not in the superficial. Would be easy to get to. They have to go in and used to tie off the femoral vein. And if you don't think that's painful, you haven't experienced anything. Okay. New slide. So we're back to your bones again. What bones form the cheekbone? What's the name of this? I don't hear it clearly. I hear mumbling. Zygomatic process of the temporal bone. What's the next part? Zygomatic bone. What's the next part? Of your maxilla. Feel it. You can feel your maxilla zygomatic process. Go out to your temporal. Go out to your zygomatic bone. You can pick up the whole thing. It's right there at the surface. Get to know your body. Next slide. What do we call this condition? Lordosis. What do we call this condition? Kyphosis. What do we call a lateral deviation? Scoliosis. Good. How many of you have scapulae that look like this or like this? Aren't you lucky? New slide. Ever seen a part of your body that has all of this together? I almost made it. The entire body is made of 4 major kinds of tissue. Which one is not correct? Now, does anybody know what kind of tissue this is? No. Look at how orderly it. This is connective. Muscle. This is smooth muscle. So smooth muscle. Muscle is one of your major tissues. What would be lining this vessel? Epithelium. So that's your second tissue, right? And then what are all of these fibers here? What kind of tissue? Connective, I just told you. So what one's missing? Nervous tissue, right? This happens to be the skin. This is the hair follicle. This is the muscle. When you get cold, your hair stands up on end. That's the little muscle that allows it. So you can see 3 of the 4 tissues. Next slide. What tissue is it? Bone. Everybody should know that one, right? You get it the very first day of class. So, the matrix of the bone is called hydroxyapatite. And what's the formula? I can get some of you very clear, right? But you do know it, and you should know it. It's not called osteoapatite, is it? No. And the formula is not Ca6PO42OH10, right? You know what the formula is. New slide. Where are we? Be specific. Are we in an adult or an embryo? Embryo. What are we seeing? What process? Bone formation, but what kind of bone formation? Endochondral bone formation, sure. You've got all of your cartilage here that's eroding, and what are we forming in here? What's this, all this? What is in the middle of long bones? Bone marrow. What does bone marrow consist of? What kind of tissue? I hear it over there. Say it louder. Hemopoietic tissue, right? Blood-forming tissue. This is where you're forming your blood as you're sitting there. How many RBCs are you forming per second? 2.5 million. So you think, look down there and look at that bone and give it respect. I mean, it sits there doing that for you every second, and you never ever say thank you. So what kind of tissue is this? Bone marrow, but you didn't have to take this course to know that. What's the tissue for forming blood? Hemopoietic, right? If I'm just forming for red cells, what am I going to call it? Erythropoietic, right? Use your tools to think. Use your tools to think. Wow, we may or may not make it. So hemopoietic tissue forms only erythrocytes? No. Only leukocytes? Both erythrocytes and leukocytes? Yes, okay. New slide. What slide is this? Is it red or white? White. What cell has a nucleus that looks like this? A neutrophil, sure. It can't be a lymphocyte. It can't be a monocyte, right? It's got many lobes. And the older the cell, the more lobes. But you won't see a basophil looking like this. This has neutral granules. It has 4 lobes. The one I showed in class had 3. So, question. Neutrophils have one large nucleus. No. Neutrophils produce antibodies. False. They're smaller than lymphocytes. No, we said lymphocytes are just a little bit larger than your RBCs. This is a great big cell. The neutrophil is the biggest of your blood cells, right? So, neutrophils, do they enter the infected area and destroy bacteria by phagocytosis? Yes. They're the first ones on the scene when you get an infection. They can move fast. What's a slow mover that's going to come in and clean up? The monocyte. Yeah, this is a macrophage. Monocyte's a macrophage. Anything that's cleaning up. Macro, big eater. What you do when you go out to lunch, right? You can call your friend a macrophage. The next one. I could tell you when I take the football players for lunch, they eat twice as much as anybody else. But I've never called them a macrophage. Next slide. Where are we? What's this? Pelvis. What's this? Femur. So, which of the following is not an identifying characteristic of bone? What do we call this? Greater trochanter. So it's a characteristic of a bone, isn't it? So you can't mark that one. What's this? It's a foramen. It's a big hole. A big hole is a foramen. What's an indentation? A fossa. This is a big fossa that we call what? Acetabulum, right. So you know characteristics of a bone. New slide. What is it? It's a blood vessel, yes, but what kind? A vein. And how do you know it's a vein immediately? It has valves. Right. So, what kind of cells line this valve? Endothelial cells. But when we classify epithelium, is this stratified or is it simple? It's simple. It's only one layer. One layer in these valves. So, will these same endothelial cells line capillaries? Sure, that's all capillaries are. with their basement membrane and their endothelial cells. They don't have all the muscle coats. Uh-oh, it's 12. We're not quite finished. Okay, but you have to go fast with me. All right, new slide. Which of these bones is not part of the appendicular skeleton? Is this one part of the appendicular? No. Is this one part of the appendicular? Yes. Is this one part? Yes. Is this one part? Yes. Okay. Same slide as 7. What was 7? Okay, we can see the roof of the orbit. Roof of orbit up here. The roof of the orbit is made up of which bone? The ethmoid? No. The sphenoid? The maxilla? No. At least you know that one. Right? The frontal? Yes. Okay. Next slide. What do we call this? Fontanelle. Good for you. You all had one. Hopefully you still don't. The anterior fontanelle is this one. It's between what bones? Frontal and parietal. You can see them. Wall, parietal, frontal. Your frontal bone. Don't forget it. It has the frontalis muscle. What bone is this? Occipital. Sure. Okay, new slide. Now, this is kind of a tricky one because I wanted the structure to be labeled here, but I had to go here to pick it up. What do you think it is? Mastoid process. Good for you. And the mastoid process connects with what? You get an infection, your middle ear. Not the inner ear. Inner ear is where you're hearing. Middle ear is where you've got your ear bones. We'll have a whole lecture on the ear. But that's the mastoid process here. Okay, next one. What bone is this? Sphenoid, right. And what's the name of the area of the sphenoid that surrounds the pituitary? Sella turcica. New slide. What bone is this? Maxilla. All facial bones articulate with the maxilla except the mandible. What bone does the mandible articulate with? Temporal. What do we call the joint? Sure. TM joint. Temporal mandibular joint. Next one. All right, what bone is this? What's the big bone in your leg? Tibia. What's the bone it articulates with? Talus. If nothing else, you can read it. What's 7? Right? What other bone coming down with the tibia articulates with the talus? Fibula. We made it, and only 3 minutes late. Okay? So let's hope. Now let's ask, did you learn something? You really learned it. Was your adrenaline high so you'll remember something? Okay, then we succeeded. All right, now we go to 131 where we have our cardiovascular surgeon. He's all ready to lecture to us.